Hi, everyone. My name is Dr. Claudia Guy, and I'm here to do the first naturopathic live session with NuSpecies. And I'm here to also answer your questions during this time as well. This segment would be for about 30 minutes, and if you're tuned in, feel free to ask questions pertaining to what I'll be talking about or otherwise. But I'll be focusing on naturopaths, who they are, what their training contains or what the training is about, and how they are a great fit for the NuSpecies clients. And so the NuSpecies clients can be very confident having us take their cases and manage their health here at NuSpecies Herbal Health Centers. So I would begin. My license is as a naturopathic physician. The degree is naturopathic doctor. And as a naturopathic physician, I am licensed to be a primary care physician. And you're probably wondering, well, where is this license from? My license is from the state of Washington. And also in the state of Washington, I also studied there. And the school that I studied there is called Bastyr University. In the United States, there are 6 naturopathic schools and naturopathic colleges that are accredited. And in Canada, there are 2 schools, one in Toronto and one in, I believe, British Columbia in Vancouver. So I have a few notes to kind of keep me, I guess, in line because I can digress. And any comments, if you just want to say hello, Dr. Guy. This might be the first time some of you are seeing me for the first time. You might be talking to me on the phone. You might hear me on the radio, and you might not have been able to meet me in person. So at this time, I will just introduce myself as Dr. Guy. And a lot of clients have known me as Dr. Guy for a long time as well, but some have been calling me Dr. Claudia. Either is fine. So as I was mentioning, there are 6 accredited naturopathic schools in the United States and 2 in Canada. In some states, naturopaths, we call them naturopaths for short, but naturopathic doctors are licensed to practice as primary care physicians. So we function as the regular medical doctor, kind of in the sense a medical doctor would in a private practice, where anyone who has any issue can walk right in and get seen, and then if they have other issues, a script or referral can be written to send them to a specialist or to get labs done. That was part of the training. But in some states, naturopaths don't get that privilege. They work strictly as a specialist, meaning that one would see them outside of their insurance network, or they will see them as referred to by another primary care physician, which in that state would be a medical doctor, and the insurance would be covered very differently. In the state of New York, however, there is no scope of license for a naturopathic doctor. So that means we primarily just function as wellness instructors, coaches, consultants, etc. And with keeping that in mind, it's really hard for naturopath to really get their full scope of practice going in the state of New York. I'm trying to keep my focus, but there are definitely updates coming in that I don't want to miss because it might be my colleagues, it might be patients, etc. I'll try to keep focused. So what are some of what's the training of a naturopathic doctor? What makes us doctors to begin with? Well, first of all, to get into a naturopathic medical school, it is strongly encouraged and often required to have a 4-year degree or bachelor's degree, and strongly encouraged and often required to have all of your pre-med courses completed. So that way, having your pre-med courses completed, having your 4-year degree qualifies you to get into a naturopathic medical school. There is not an entry exam. At this point, an entry exam has not yet been designed for naturopathic medical school, but the admissions process is extremely competitive because the classes are very small. The schools are very small. My school, the school that I attended, which was Brass University, I think accepts the most during the admissions process, which is about 100 students. Other schools, it could be as few as 30 students. And of course, these are thousands of applications coming in. So the process is extremely competitive. So they, as far as I know, during the admissions process, you need to have all your T's crosses, all your I's dotted, and your GPA. You probably would not get considered if your GPA is less than a 3.5. And I mean, then that's actually very, very generous. Actually, it's essentially a B. But uh, they really try to get the finest quality people they can find, because at the end of the training, these folks will be doctors. So they're really looking for folks that are very motivated, that show themselves to be very intellectual and scholastic. Currently in the United States, there are only 20 states that carry a naturopathic license, which means there are essentially 30 states that do not carry a naturopathic license or a naturopathic license for any kind of scope of practicing. In these 30 states, in which New York is included, a naturopath would fit into a place like NuSpecies, where we work as consultants and wellness coaches, and essentially working to help clients with the formulas that NuSpecies use, because we are quite well trained in the herbs that they use and in the goals that they're expecting for their clients. And I'll talk about what some of our actual classes are in, the actual training and the hours and the clients we see. We'll get into that in a little bit. But I want to talk about why in the state of New York, why when you come in to see us here at NuSpecies, why we might explain that there's some limitations in what we can offer to you. One, working with NuSpecies, and two, being a naturopath in the state of New York, there are some limitations that we can offer. We can't write you a prescription at this point, according to the law, and we can't draw your blood to take labs at this point. I mean, we offer different kinds of testing, but it should not include any blood work. We can request it from your doctor. Thank you for those that are joining us at this time. Welcome. But we do encourage you to have a wonderful relationship with your primary care doctor. That way, when we are suggesting that you get certain labs done, that you will kindly ask your primary care doctor to get those done for you, because you're working with a wellness consultant and they are very knowledgeable in labs, and oftentimes we read labs a little differently than your medical doctor would, and this allows us to really fine-tune your health, because we're creating a very narrow range of what's healthy, and most blood work creates a very broad range of what's healthy. And in fact, that broad range doesn't really work for you when you're really trying to create optimal health. And I can talk about that later on if you want to ask questions about that. I'm leaving that as a way to ask questions. So what's the approach of a naturopathic doctor? The system of health that pretty much emphasizes prevention and self-healing through natural means first. So it's not that a naturopathic doctor does not use conventional means. In fact, we do. My training specifically in my scope of practice in the state of Washington, often we can write prescriptions, and we can often have minor office procedures done, and we can also thank you, Karen, for joining us. Yes, NuSpecies is a wonderful company to work with, and I'm very happy to work for NuSpecies. Thank you, Karen. And also, we can also refer clients to specialists to get certain procedures done. But the foundation of being a naturopath is seeking all natural alternative measures first. And sometimes, primarily, the issue is resolved. So naturopaths often work with chronic cases, meaning that cases that are not being resolved through medication. If you have an issue that has been resolved through conventional means, that's great. But if you have a case that's ongoing for decades, probably even just months, and you're not really getting any assistance or help, or it's pretty much just dragging on, then seeking help here at NuSpecies or with your naturopathic doctor is probably the next step. So naturopathic medicine is sort of a blend of old and new medicine. We do focus on diagnostic training. That's part of our training. In the state of New York, we don't diagnose. However, all of our clients often come in with their own diagnoses because they've been dealing with these issues for a long time. But just to kind of give you a little input in that, naturopaths may even use that, even though we have conventional diagnostic means and we use that language, we might use other types of assessment or diagnostic use. For example, if someone comes in and I feel like they have liver stagnation because I feel like their liver is not processing toxins well, I might use that as a term to be used. But that term is sort of a naturopathic lingo, but it isn't a diagnostic term. The diagnostic term the person may have, it may be fibroids, uterine fibroids, it may be endometriosis. And I might say this might be due to liver stagnation. That kind of terminology, like liver stagnation, may also be used in acupuncture, oriental medicine. They focus on organ systems and how systems are either blocking diseases, they're blocking energy and allowing diseases to happen. So you might find that terminology or certain terminologies or diagnostic words we use in naturopathic lingo similar to those in acupuncture or Eastern medicine, Ayurvedic medicine, or traditional Chinese medicine, for example. Some of the modalities that we are trained in that we use in practice would be nutrition, botanical medicine, homeopathy, counseling, hydrotherapy, and also by mind-body medicine. And oftentimes, someone would need all of them. So a naturopath often should not be someone who only does homeopathy because it may not necessarily treat the whole person per se because they might need nutrition. And if you don't focus on the nutrition, that would be a problem. They might need help with the physical body part. And if you don't work on that, meaning that they may need massage or they may need hydrotherapy, if you don't focus on that, you might be missing part of the healing. Also, if you don't focus on mind-body medicine or even counseling, you might miss healing that person too. So a naturopath can't really specialize in the modality because the modalities are really all of our tools. So it's like saying, I only want to use a hammer when in fact there's so many other tools to use to build a house. That means everything becomes a nail and you'll just be using a hammer. You won't have a house built. So a naturopathic doctor has many modalities beyond the ones that I just mentioned to help us with healing with. So here in NuSpecies, we do implement, sometimes we have to implement counseling. Clients come in stressed, anxious, or depressed, and we have to kind of acknowledge that for them. The NuSpecies formulas work excellent, so we don't even have to really speak for them. They do an excellent job here. And sometimes we have to look at their medications and find out which medications might be giving them the symptoms of which they're complaining to us for the day. So for example, they may have a chronic cough, and we might say, well, I see that you're on lisinopril. It's quite possible lisinopril might be causing that chronic cough. Why don't you discuss with your doctor switching a different medication and seeing if that goes away? So that's us also acknowledging one aspect of their care here. So even at NuSpecies, we do implement more than one modality. We can't just simply just do the herbs, and that's why here at NuSpecies we fit in very well because we have other tools outside of the formulas to kind of help the client in front of us. So as I mentioned, our training starts off with a 4-year medical degree, a 4-year bachelor's degree, and a GPA preferably above 3.5. And then when you're in the naturopathic college, you essentially have the first 2 years that are about the same as a medical student. So you have the same basic sciences as a conventional school. These sciences are like anatomy and physiology, biochemistry, histology, neuroscience, pharmacology, immunology, embryology, gynecology, all the ologies. If there's an ology at the end of it, we have to take it. And at the end of the first 2 years, all of those ologies that we studied becomes the first part of our licensing exam. And at the after the first 2 years, where we take all the sciences, then we do all our clinical training. So we need about 600 patients at minimum to qualify as part of our training. We need about 1,200 to 1,400 hours of clinical training, and we need about 130 to 200 hours of working, shadowing another profession outside of naturopathic medicine. It could be a medical doctor, a gynecologist, a chiropractor, whatever the case is, just so we can have exposure. And students often do more than the requirement because really, as a doctor, you want to know as much as you possibly can. Now, well, you might look at 600 patients and see that's probably not enough because you might say, oh, medical doctors see much more than that. But let me explain what it is when we're doing our training. First of all, when we're doing a first consultation with clients that are as students, medical students, the first visit is oftentimes an hour to 2 hours where we're gathering an enormous amount of history. So it's really impossible to get thousands of patients as part of our training to be qualified as doctors when you're spending 2 hours with every client, almost every client at the beginning. Some of our modalities is very time consuming. If you have to do a hydrotherapy session with a client, if you have to do a physical medicine training with a client, if you have to do a counseling training with a client, these take up hours. So when we are trained, we're well trained in all modalities, but a patient taking care of that client in front of us uses up a lot of energy and a lot of time. So when meeting 600 minimum for graduation is a lot of work. Essentially, at the end of seeing a client, you have spent an enormous amount of time with that client, just incorporating the modalities, counseling them, working on their nutrition, taking their whole history, if they need treatment, what those treatments entail, et cetera, et cetera. And so 600 is definitely not a lot when you look at it on paper, but the amount of hours behind those 600 patients are tremendous. That's why it's a minimum of 1,200 hours because it's about 2 hours per patient, but most of us exceed way beyond 1,200 hours and way beyond 600 patients at the end of graduation. That's just the minimum. When it comes to the amount of hours spent studying, it's been calculated that we have about 4,100 hours of actual class time, which is required by the accreditation board. So that's an enormous amount of study time. And let me tell you, that is very rigorous study time. Oftentimes, well, in the state of Washington, there are quarters. They're not semesters here on the West Coast. So every quarter, there's about 28 to 30 credits. So essentially, you're in school 7 hours per day. It's literally full-time. It's not college where you might be full-time is 12 credits, and you're in school maybe 4 hours of the day. So you're doing about 7 to 8 hours of class time every day, and then you have to do a certain amount of that in studying as well. So essentially, you're just full-time student, like from sun up to sundown, it's studying, and then there is some sleep, and then we try to balance that with some physical activity, nature walks, meditation, etc. We try to maintain a certain naturopathic lifestyle, which is very difficult to do in naturopathic school. But getting in that 5,000 hours of training, and it's oftentimes 4,000 minimum. Oftentimes, like myself, I took extra training in hydrotherapy, extra training in women's health, extra training in pediatric courses. So my study time was way beyond 4,000 hours of school. And that's the case with most naturopaths. We want to glean so much information that most of us are way beyond the 4,000 hours of studying in our 4 years of training. So when I was comparing, I was trying to compare the hours of nutrition between a medical doctor and a naturopathic doctor. Of course, you expect us to have far more training in nutrition. We study clinical nutrition. We also study whole foods nutrition. And so when I put the hours together, it came up to about 150 to 200 hours in just nutrition training. And a medical doctor is essentially 7 hours. So when you go to your doctor and he is giving you a medication, it's because he has extensively more training in giving you the medication than in the nutrition. So when you come to here the NuSpecies and we say, well, these certain food items that you're eating are probably aggravating these issues, you're like, well, why didn't my medical doctor say that? Well, because your medical doctor only had 7 hours of nutrition, and it probably wasn't enough for him to highlight these issues that you have going on here. But here at NuSpecies, we can definitely figure what those things are, what's kind of hindering you in accelerating your health. And in fact, NuSpecies had already put together a new life program in their NuSpecies app, which is fantastic because I can just have clients refer to that because that diet works for almost everyone in front of us. There probably isn't a person who would not do well on the new life program. So it takes away far more time for me having to screen every diet, to go through every person's diet in front of us to see what's going on. If I do have them go to the New Life program as best as they can, then that works out fantastic. Then it really resolves a lot of the dietary issues. But we are able to pick through your diet and realize what is the hindrance. For example, a lot of clients might be told they have high cholesterol and to come off eggs. But what they don't realize is that ice cream can contribute far more to your cholesterol levels than eggs can. And so some patients don't do that. Their cholesterol is still high, and they're like, I have cut out eggs and I've cut out fat. But what they are having are poor quality fats. We call them hydrogenated fats or trans fats. And these fats aggravate someone's cholesterol levels far more than, say, the olive oil or the egg yolks. So even even that kind of nutritional information, as basic as it is, the doctors took them off eggs, but they didn't take them off ice cream because they probably didn't realize ice cream contributes to cholesterol issues as well. So these are some of the things here at NuSpecies that, this is the kind of information rather at NuSpecies that's extremely beneficial to you coming in, and having this service provided to you by NuSpecies is extremely invaluable. And some clients are very appreciative of having us here at NuSpecies. It makes a tremendous difference on their health and their approach to health. And it also helps them understand their bodies and how their bodies work. If there's anyone who has any other questions, I'll just kind of sum up with some other information. I see Ms. Graham is live with us, and thank you, Ms. Graham, for your thumbs up. And I also see that Dr. McDermott is with us. Dr. McDermott is also a naturopathic doctor. She is primarily in the Brooklyn location, and sometimes she comes out to the Long Island office. I, Dr. Guy, I'm primarily in the Long Island office, which is Elmont. And I'm here Friday, Sunday, and Monday. So so that's great. If those who are tuned in want to say hi, say hi. I would love to say hi back to you. So some of the principles of naturopathic medicine is extremely important. It really helps us focus on our medicine. So there are about 6 principles. The first one, they're really not in any order actually, and I would hate to put one above the other, but I would read them in no specific order. It's the healing power of nature. The healing power of nature is essentially what we do here at NuSpecies, essentially using these fine quality formulas, these well-developed formulas, to truly use the power of nature to really turn around your health. And they're trying to really work on a cellular level. they're full of micronutrients and enzymes, which can really help with biochemical mechanisms. Essentially, all these pathways require these nutrients. So using new species formulas is definitely integrating in part of our principles, which is the healing power of nature. Hi, Sharon. How are you? Thank you for joining us today. So another principle is treat the cause. So essentially, clients know that they may have an issue and, for example, they have blood pressure issues and they go in and every time they see the doctor, they get a new script because the blood pressure isn't being controlled. So there's several reasons why blood pressure can't be controlled. What I see primarily in front of me, two main reasons is diet, and the other reason, which is almost primarily the reason, is stress and anxiety. We live in a very stressful, anxious world, and a lot of clients who are in front of me often have two or more jobs, or or they're trying to keep up with a certain lifestyle. They have a home, it's very expensive. They may have family life. So high blood pressure can have, when it comes to the cases that are primarily in front of me, two main issues: a dietary focus and a lifestyle focus. But I've had clients who come to NuSpecies where their blood pressure is due to adrenal malfunction. Your adrenal glands are not functioning properly. Blood pressure can often be due to your kidneys are failing, and your kidneys are very helpful in regulating your blood pressure. And if your kidneys aren't doing so well, your blood pressure goes up. And when their kidneys are probably failing because they had diabetes that was uncontrolled for a long time. Hi, Kayan, how are you? Thanks for joining. Um, so if your A1Cs is through the roof, like it's at 7, 8, 9, 10, 11, 12, 13, and I've seen A1Cs walk in that were 13, that can severely damage your kidney and severely damage your arteries and essentially lead to high blood pressure. So essentially treating the cause, it really depends on the person walking in. There is no one cause that is across the board for everyone for any disease. Some people's diabetes has been triggered by prednisone. Some has been triggered because of poor eating. Some has been triggered through gestational diabetes, and it's just really hard for them to get their blood sugar back under control. So every issue does not have the same cause. So when the client is sitting in front of us here at NuSpecies, we help them identify the cause, and it's really great. The next principle in naturopathic medicine is do no harm. And this is the same principle that medical doctors use. They also have this principle in their oath. And even though their medicines are very powerful and toxic and sometimes very, very necessary, their real intention is not to harm you, even though you think, oh, the doctors are trying to harm me. They really are not. They truly really do want to help you. And you have to understand the only way they can is through their own training. So the surgeries can help you, the medication can help you, but maybe it's not for everyone. Hi, Mava. Thanks for joining us. And I hope I'm able to see some of you eventually, either as phone consultations or in the office. I hope to meet you, Sharon and Mava, soon. Maybe you can just schedule a phone call with me sometime. That would be wonderful. Another principle of naturopathic medicine is doctor as teacher, and I love that principle. That principle is essentially who I am. I love educating. I love being an educator. I love helping people be empowered by knowing how to control their health and be part of their health and be their own advocate for their health. I think our medical system doesn't allow the patient to be an advocate. And I think people are used to the doctor just doing everything and they being very passive in their health. But I always encourage clients to be very proactive in their health, not being passive. So if anything is the doctor puts a script in front of them, I encourage them to ask, well, what is this script for and what are the side effects? Because they're coming to me to ask me, what is this script for and what are the side effects? And I say, Mr. and Mrs. Smith, I didn't write the script, so I really don't know what it might be for, but I can tell you what this drug is often used for. So at the end of that conversation of telling them what the drug is for and what it possibly might have been for and what the side effects are, I said, well, now you should definitely take this to your doctor and use this as an icebreaker with your doctor, and have an open session as to what all these medications are for and what is the true goal. What is the goal here? Is the goal here to get our blood pressure down? And if I get it down, can I come off this med, et cetera, et cetera? You need to establish that communication with your doctor. Do not be a passive patient. Essentially, a passive patient will not get well because then they're really not advocating for themselves. You're really just taking everything the doctor's throwing at you, and then what happens is that you really aren't responding to yourself. So, for example, what happens is that there might be some drug interactions, and a client might not be feeling well, and they decide to stop taking their medication instead of discussing it with their primary care doctor to find out what could be changed. They come and discuss it with me. I said, I am not the prescribing doctor. I think these two drugs might be interacting, but you have to have this conversation with your doctor. So we really do here at NuSpecies, we really do encourage you to have a relationship with your doctor, because I think your doctor would be a little bit more attentive to your case when he realizes you ask questions. Okay, he realized that you're very concerned about your health, and he might even help you more and even have a better discussion with you about your health if you're a little bit more proactive. And of course, treating the whole person is another principle of naturopathic doctor. Some naturopathic doctors do isolate certain organ systems, but it's not essentially without realizing they have to treat the whole person. So GI issues, gastrointestinal issues, have a multitude of different causes. It could be microbial imbalance, digestive issues, toxicity. It could be anxiety and depression. It could be a multitude of different issues, stress. All these issues cause gastrointestinal issues. But if you go to a GI doctor, he will only treat the he will look at the digestive tract, and he will do an endoscopy and said there's nothing wrong, and then he'll send you anywhere, and you're like, something is wrong. And that's probably because it was a mental emotional issue. That's probably because you're probably eating the wrong foods, and it's really hard for them to see with a scope that it's the wrong foods, et cetera, et cetera. Some people have celiac disease. That you can see in a scope, but what if you have food intolerances that cannot be seen on a scope, an endoscopy or a colonoscopy or barium x-ray? Sometimes you don't see these things. So isolating different body parts, decompartmentalizing the body, that's a big word for me to say, can actually harm the patient, because what happens is that you don't actually get to the root cause. We're coming back to another principle in naturopathic medicine. So treating the whole person is essential, because where you hurt is not where the problem is oftentimes. And the last principle, which has been added most recently, and I say in the last 10 years, is prevention and wellness. Prevention and wellness is inherent to naturopathic doctors, but most people haven't come to us before they get sick. So even though prevention is something we love to do and we do as educators, oftentimes people are not coming to us before they're sick. Most of the time they're coming to us because they are sick. So prevention and wellness is definitely something we embrace. And we can probably prevent you from having more issues when you come to us. So some clients come to us when their issues have piled up for so many years, and their bodies are so damaged and they're so broken down. And when they come in here to NuSpecies, we have to work so hard with a multitude of different formulas to really get them feeling well again. So try not to wait till you're so damaged. If you're on one medication, that means something isn't working, and we could even try to see if we can rectify what's broken or damaged in the body. But when you have 17 medications, and it really it's really hard for us to see when someone is damaged, because we really want to help you, and to see you in such distress and such desperation really tugs at our heartstrings. So it's not that we can't help you. It's just that we know that the desperation to feel well is so intense that the patience to get well which takes several months to rebuild a damaged body you may not have, and or you may be told that you're in hospice or that you're dying and you may not have the time. But if a body is that damaged, we still could only work with the healing power of nature. We could only work with what the body can do. Here at NuSpecies, we don't push the body to do what it cannot do. We can only work what the body can do, but we are the help that we offer does help the body heal very well sometimes. So I wouldn't discourage those who are extremely sick to not get in touch with us and feel better. And that's mainly all that I had for our talk today. It's pretty much naturopaths and how we work really well with our NuSpecies clients and how we're a good fit for NuSpecies. And I'm really and how we're so well trained. So if you walk into us and we're not an MD that you expect us to be, that being an ND is probably exactly what you want us to be with working with your health here at NuSpecies. You are looking for a doctor, probably outside the conventional model, because you already have a conventional doctor. You already have a doctor who does mainstream medicine, but you're looking for something adjunctive. NuSpecies is great for adjunct care, really to kind of get your body cleansing and get your body rebuilding and sort of reestablishing some kind of balance or homeostasis in your body. Everyone's different. And I say this to every client, everyone's different, because the body in front of us may be more damaged than we think it is. The body in front of us is dealing probably with more stress than someone else. The body in front of us may be more medications than some other bodies. And there's different reasons why everyone's healing is at a different rate. But we always encourage patience because it took many years to get sick. So it would also take a very long time to get well. But the process of healing is usually much shorter than the length of time it took you to get sick. So that's good news. But you do need to allow the healing process. All right. Okay. If there aren't any questions, and I thank you, Ms. Graham, I thank you, Sharon, thank you, Kayan, I thank you, Marva, all for tuning in and saying hi. And hopefully I get to see you all soon or hear from you soon. And all the others who join us, thank you so much. And what those that have listened today, what you can probably do is share this video. Hi, Arthur. You can share this video with your friends and family so they can understand a naturopathic doctor and what we do, what we offer here at NuSpecies, so they can be very comfortable with us taking their case and managing their health issues here at NuSpecies. So otherwise, I have a heartfelt thank you to all those who joined me. This is the first of several live sessions to follow, conducted by either Aston, Jillian, any of our naturopathic doctors, and or myself. So we're trying to educate our NuSpecians, as we call them sometimes, to be aware of what we do here at NuSpecies. Thank you for the thumbs up, guys. I really appreciate that. We want to educate our NuSpecians, and we want to also, well, some people are, oh, someone's asking, when is our next seminar? It's at the end of this month. I thank you so much for asking about that. We will be doing our seminar soon. We are bringing them back. We will be repeating some of the old ones because they're extremely popular. And we're doing them again because, again, some folks couldn't make it last time. And the information was not recorded, and so clients were not able to see a repeat information on it. But we're bringing back our sessions the end of March, around March 29th, okay? If you do permit me to look at my calendar here, I will tell you when. It should be in about a week. Yeah, next Friday the 29th, and then April 1st, Monday, April 1st, we will definitely have our seminar. So it would be every month we will have a seminar. All right, Arthur. So there will be lots more. He asked if there will be lots more. There will be lots more. Um, we will do men's health, women's health. We will do blood pressure. We will do diabetes. And a highly requested seminar is rebuilding, how to rebuild your DNA. And some folks is like, that's impossible. But I will tell you that's very possible. That's what we do here at NuSpecies. In fact, part of the NuSpecies logo is a double helix DNA. And it's not there for no reason at all, but the NuSpecies logo is a double helix DNA, and that's because they understand that your DNA is where disease starts, and it could be where it ends. It could be where we can halt it. So rebuilding the DNA is fantastic. Okay, so I just realized I probably should have responded to Arthur in writing, but hopefully he heard what I said. Thank you, NuSpecies, for responding to Arthur and helping him. And there'll be lots of live Facebook sessions as well. So in order to not miss any of our sessions and to not miss any of our seminars, please download our app and please like the Facebook page, the one that says NuSpecies, okay? It's extremely important if you don't want to miss the seminars and you don't want to miss the live sessions and any other updates. For example, when NuSpecies goes to Jamaica, if you're in Jamaica and you want to see Aston for a one-on-one consultation, stay tuned to your NuSpecies app, and the NuSpecies app will tell you when Aston would be in Jamaica and when you can go in for your one-on-one sessions. If Aston's not there, you can schedule a live session, a face-to-face session with any one of our naturopaths. We do take virtual visits. We take phone visits from Jamaica and most other islands as well, or the places, even here in the United States. So those features are available. We're very tech savvy, which is great. We're trying to keep up with changes and keep everyone connected to NuSpecies. So thank you everyone for joining me today. And I like all the thumbs up and all the love that's been sent my way. It is my first live session. So I thank you for encouraging me and for joining in. So at this time, I'm going to say bye, and I hope to see you all on the next seminar and the next live session.